Thank you very much, Ted, for joining us today. To start off, could you share with us a bit about your role as the Vice President of Innovation and Partnerships at Hamilton Health Sciences and how it connects to the development and implementation of your organization's use of point of care technologies?
Thanks so much, Amanda, for the opportunity to meet with you today. It's an exciting role that I have as an executive, senior executive at Hamilton Health Sciences, leading our innovation and partnerships. Our focus in this area is really inward and outward. We find and identify our clinical champions, which can be senior administrators, can be clinician researchers who understand best the challenges of delivering healthcare and what some of those unresolved challenges are, so that we can then reach out, in some cases, to our industry colleagues and work closely with them to co-develop point of care solutions for some of these challenges. Other times, we'll bring industry innovation directly into the hospital. But again, we need to make that connection to our clinical or administrative champions.
Could you talk about how these technologies are improving the precision and speed of diagnosis in Canadian healthcare? Does it lead to better patient outcomes?
Absolutely. And we have such an exciting partnership with an up and coming AI imaging company, which is known as Altus Labs. Altus Labs has been a leader in lung cancer prognostic research, training their algorithms on over 100,000 CT scans, which helps the oncologist to predict disease progression and the treatment effectiveness. Seeing their strength in this area, it was a natural and easy fit for our team, which has quite a bit of expertise in the area of breast cancer data and research. And so we're working with them to expand their offering into the area of breast cancer, which is super exciting because so many Canadian women have to contend with breast cancer as a disease.
When you say partnership with Altis Labs, is this a collaboration on doing research, or are you on a P3 collaboration here? That
Yeah,
is
thank
beyond
you for
research.
Thanks for clarifying. So I should acknowledge that we're also part of a network in Hamilton called the Synapse Life Sciences Consortium, which is Hamilton's research hospitals and McMaster and others. And through that network, we access federal funding, which pays or at least partly sponsors collaborations with industry so that we can co-develop this product with Altus Labs.
Oh, all right. Thank you very much for that elaboration and clarification. So, from your perspective, okay, um, I'm sure there are many, many, many promising point of care innovations currently being developed. But what in particular um, is the most promising, perhaps, or one that you would want to focus on?
Yeah, there's one I really want to just mention. So Dr. Pablo Serrano is a surgeon at Hamilton Health Sciences, and he's leading the clinical validation for a product by a company known as Fluid AI. And what Fluid AI, which is based in Kitchener-Waterloo, has is the ability to support surgeons who are doing bowel surgery in earlier detection of sepsis, which is a serious, potentially very serious infection post-surgically. Now, part of a common cause of that is when as the bowel is sewn together, if there's a very small leak, it can cause this infection. So the Fluid AI product is able to use a sensor in the postoperative drain and an AI algorithm to identify the risk of this condition very much earlier, like in day 1 or 2 or 3, and not day 7 or 8, when it's almost too late to effectively intervene and treat the condition well. So it's a great example of how Dr. Serrano and HHS is partnering with an innovative company to use AI techniques and sensors to better serve our patients.
So this example that you gave is more on the diagnosis and post-surgical area of treatment. How about integration of real-time data? how has it affected the way healthcare professionals deliver care to patients? Are there any specific examples at Hamilton Health Sciences where these technologies have made a significant impact?
Absolutely. This is an exciting area of development. Over the last decade, there's been quite a bit of research at Hamilton Health Sciences led by Dr. PJ Devereaux and Mike McGillian on the value of continuous vital signs monitoring. As I'm sure you'll appreciate, historically, the model of care has been that a nurse might come into your room and check your vital signs every 4, 8, or maybe 12 hours based on whatever your condition is. But what their research has shown unequivocally is that in the time between those measurements, your body can undergo seriously deterioration that go completely undetected. And so, based on that research, which is more than 40,000 subjects in the VISION trial, they've developed a program which we call the Protect Continuous Health Research Program, which is also a clinical service where we monitor our patients through remote automated monitoring with the intent to early identify their deterioration so we can intervene and adjust their medication or provide other important healthcare interventions.
So, you mentioned remote automated monitoring. Does this mean that you're expanding remote healthcare?
Yes, absolutely. So one of the things we've noticed in the research is there's a big gap upon discharge from the hospital. That's when a lot of these complications can emerge. And unfortunately, in many cases, the patients don't have a lot of options in terms of seeking help. They often will end up in the emergency department, or they might get to their primary care physician if they have one. But what this program does, it creates this continuous connection between the providers in our team, which is a nursing-led team, 24/7, and the patient, so that they always have someone to reach out to and seek help with. And there's structured, proactive care being given to them where we're looking for opportunities to improve their recovery, ensure that they have the correct medications, that they're getting out of bed and doing the right things. And a lot of times, or at least sometimes, we find things that the patient doesn't even realize are a concern to them,
Mhm.
and we can intervene because we have access to this data. So it's been a very powerful program. We've had over 2,500 patients go through the program. It's allowed us to reduce the length of stay at the hospital on average by 2 days per patient and reduced our emergency department visits and readmission rates.
Wow, that's a big improvement. And I was wondering because you were mentioning, it somehow helps the hospital personnel on, monitoring on, the patients who should be staying or how long they should be staying in the hospital. But do you have this integrated also with, scheduling patient visits to the hospital, say for follow-up checkups?
Yeah, exactly. So the standard procedure, so when you receive your health kit on departure from the hospital, the first full day you're at home, the nurse and physician will do a 30-minute visit with you over the video, and they'll go through head to toe and make sure everything, your wounds, your medications, all the things you need to be successful in recovery are in place.
Mm.
And then there's follow-up scheduled video visits on day 7 and day 14. And then if at any time in between there's a concern about how your health is looking from the perspective of the vital signs, or maybe the patient's complaining about a particular problem, the eating or whatever, then you can have a visit scheduled the same day. So it's very, very powerful, and it gives the patients the confidence to know they're being cared for by
Mhm.
people. And this, I think, is a very important point. People that are expert in their particular surgical pathway, so they know for the particular surgery they've had what the greatest risks are. And also, of course, they can then, through their perioperative medicine physician team, also reach back to the surgeon if necessary.
Mhm.
So an extremely powerful connection.
It's quite impressive, quite impressive. And so has all of this resulted in reduction of wait times for other patients?
Yeah, so the big thing to look at in this program is how it's reducing length of stay. So if You take 2,500 patients, and on average, their length of stay is reduced by 2 days. You've just opened up to maybe 5,000 bed days. Those beds can then be used for patients who are waiting for other procedures or need care for other reasons.
Wow. And considering all these improvements, what would you say? Because what I'm seeing, what I'm hearing right now are all the benefits. But what are the challenges in adopting more or scaling innovations like point of care?
Yeah, so as I'm sure you can appreciate, especially in Ontario, our hospitals are extremely resource restricted, both for staff, expert staff, but also funding, even the capital infrastructure. All those things
Mhm.
are not well resourced. So
Mhm.
it's so helpful when we receive some additional funds through our network partners, through the federal government often, and also, we use research to help develop and build programs like the Continuous Health Program, and they bring the funds with them from the
Mhm.
research, which helps the clinical service adopt and overcome some of those challenges. And I think then the last challenge is that part of what my job entails is ensuring that we make the right connections between our industry innovators, our clinical leadership, and our clinical, physicians, so that they're focused and able to connect and make the right things happen in a timely way.
There are many innovations that are brewing, but one thing that I have often heard is that there are many budget cuts that have been
Mhm,
happening. So most of the case studies that I've seen on P3, wherein, it's the private sector providing the funding, has to do
mhm,
with physical facilities of healthcare providers. It's more on that area. I found only one case where P3 was resorted to for digital transformation, and that is at the National Health Service in England.
mhm.
So, do you think this is something that can be done in Canada, or is it being done at all?
Like a public-private partnership?
Yeah,
Is that what you're
but with the private sector funding.
Oh, I see what you mean. So, I think that the government is moving that direction, expanding the imaging licenses to CT and MRI, and they're also, I think, working to create capacity in the area of more routine surgeries, surgical centers. So I think
Mhm.
that's definitely going to be interesting to see how that works. I think it's too early to say how well it will work, but certainly, there's lots of experience in the area of imaging. We've been doing that for probably 40, 50 years. So,
Mhm. Okay. So in terms of partnerships and collaboration, your role involves partnerships and innovation. And how important are these collaborations with tech companies, research institutions, and other organizations in driving the adoption of point of care technologies?
yeah, that's a great question. I'm going to give you two examples and two very clear examples. So, the first one, what's called an edge. We're a hospital part of the Can Health network, and the hospitals are referred to as edges in this network. We are essentially receptors of industry innovation. So in Ontario, as a publicly funded health system, our government spends over $50 billion per year on healthcare services. So it stands to reason that it would benefit Canadians if those resources were spent on Canadian company services, right? Because now you're building economic development and also providing that really critical healthcare service.
Mhm.
So CanHealth's mission is really to make it easier for hospitals, so-called edges, to acquire Canadian innovation.
Mhm.
And so we were very fortunate to connect with Karen Muller, who's the founder of SterilCare. SterilCare is a company which is committed to reducing the rate of sepsis or infection associated to catheters and other things that we have to use in the hospital. We were funded substantially, more than $250,000 by Can Health to trial her product across 3,000 plus patients and demonstrate that, in fact, it would reduce the rate of infection and catheter blockage and all of these things. And so through that collaboration, we finally now been able to make the business case that even though there's a increased cost to use her product in our catheters, in the end, it's better for the patient and it reduces the rate of
Mhm.
sepsis, and it's actually cheaper. So a
Mhm.
great example of adoption of the Canadian innovation, the sterile care product through the Can Health Network. One more example, which I'm really excited about too, is through the Ontario Bio, it's called the Bio Early Adopters Health Network. And they sponsored us to trial and adopt a super powerful tool, which is called Voice, VOYCE. Now, the interesting thing here is that we sometimes forget, but we have so many challenges and problems in healthcare, we forget that some of these probably could be resolved and we just forget. And so in most communities, and especially in Hamilton, we have many newcomers. And a lot of our newcomers don't speak English at all or well.
Mhm.
And it creates problems at the point of care because it's not always possible to schedule an interpreter. And a lot of the times you're just kind of, um, trying to find someone around, maybe a family member or whoever, to make these really critical exchanges of health information. And so what Voice does, which is profound, is it opens up a network of over 2,000 interpreters
Mhm.
at the point of care through a tablet. So you can just ask for one of 220 languages, even American Sign Language, type it in, Swahili, whatever it is, and up comes a person who's trained in medical terminology who can conduct a professional translation. And then you can document that in the chart. And it's also very cost effective because you're only charged for the minutes of that particular translation service, not for like 4-hour block for bringing someone in. And so it has changed the game for us in terms of how we're able to serve our newcomer communities. Well, not even newcomers, but just people that don't speak English. Extremely powerful collaboration, again, made possible through the OBIO Early Adopter Health Network.
That's very helpful, that simple technology of translating or helping better communications to happen. And you shared a material on the Health Innovation for All event that you held a few months back. There's one line there that I found accurate and very interesting. And that was, we need more roads and not Ferraris. So, in terms of infrastructure, what would you say is most needed for greater collaboration to happen?
Yeah, so I think in terms of infrastructure, the key thing is to find better ways to connect patients and providers. So that could be that we create, like, one of the challenges our patients often have in our community is just getting to an expert clinic. Believe it or not, transportation is a substantial barrier. So thinking differently about how do we use transportation to enable people who maybe don't have access to transportation or have to take 5 buses to get there. Simple things like that, I think, are important to consider. Of course, we can use digital infrastructure, video visits, all of those things, but we also then have to make sure that our patients have access to secure Wi-Fi and that they actually have the appropriate devices to use for those conversations. So I think a reimagination of what is needed in terms of providing that healthcare is something that's going to be very important. There's great willingness now to use virtual care, which is helpful, but it's not going to be the only infrastructure we need. We also need more basic things like transportation.
Is connectivity also a concern, or perhaps other things like knowledge of how to use? I'm not sure, but like, would there be certain sectors of the population that you serve that would need to be taught how to use this digital technologies?
Yeah, so where we have specific programs like the Continuous Health Program and others, in general, we've done a great job of creating ways for people to learn how to use it easily and effectively. So that part seems to be working quite well. I think it's where, we have lots of other paths people have to take to get access to healthcare that are not as well developed. And that's where we need to turn our minds to, like, making healthcare much more accessible in the community by making healthcare part of the community and not some big building that they always have to go to and, somehow find their way through a maze of hallways to get to their provider. So I think just rethinking that would be important.
Are there other examples of successful collaborations or partnerships that, led to better integration of innovative point of care solutions that you want to share?
Yeah, I should mention as well, there's been some major industry and research investments in our programs, like the Protect Lab was funded by the Canadian Foundation for Innovation, which funds research infrastructure, which makes it possible to expand our program there. And then, of course, industry has been incredibly generous in terms of providing their tools and resources, and sometimes straight up cash to build platforms to enable us to explore new research questions. So I think just important to recognize our industry partners and our federal research agencies as well.
And looking ahead and say 3 to 5 years down the road, which of these point of care technologies or emerging trends or any other uh, solution that is being developed right now do you think will redefine patient care?
Yeah, that's a great question. I think what is most exciting is that there's a shift now to bring hospital and clinical services into patients' homes. So they can actually get pretty advanced care through support in the home. And patients then will have much more of a role in that healthcare, much more decision-making power and, influence in terms of what kinds of care they end up receiving. So I think that's a big shift. And it's no longer, go to the hospital to do something to me and then I'll go home. It's more like, okay, I'm going to contribute my data, I'm going to contribute these measurements, and now you're going to explain to me how that impacts my healthcare, and I'll have some say about what procedures we do next. It's a big, big change.
Yes, I would have to agree on that. And that's, you mentioned two things, bringing healthcare to the citizens' homes. And that is very, very wonderful, instead of them having to find where they can get treatment. And of course, the citizens owning their data. And that's another thing that I believe is uh, a point of focus now with increased, data that is being analyzed and used to improve the healthcare delivery. And lastly, Ted, um, what advice would you give to healthcare leaders looking to invest in point of care technologies to improve patient outcomes and system efficiency in Canada? You've done so much. What advice would you give to other organizations that are just starting, perhaps?
I think the best advice I would have is to understand the problem you're trying to solve in detail. Like start with that in a great bit of effort on that, spend most of your effort there. Once you have a clear understanding of the problem you're trying to solve, and then you can sort of look around and see who's maybe had success with this particular problem. If no one's had success with it, then it might be something you're going to have to spend a lot more time working on and finding collaborators to address. But often it's easy to see something that looks really promising, but then ultimately you realize it's not really solving an important problem, or maybe there's just not much need for it as you might have thought, and that sort of thing. So we always like to start with a very clear problem definition and then looking ahead, well, what will success look like? How are you going to measure the impact and evaluate that this is working? It's crucial that you then understand what your success metrics are.
Thank you so much for sharing your incredible insights, your passion for innovation, and the remarkable work being done at Hamilton Health Sciences. It's really very inspiring to hear about how technology and collaboration are shaping the future of patient care, not just within the hospital walls, but right into people's homes. I think many of us are walking away from this conversation feeling hopeful and empowered by the possibilities. And to all our listeners, thank you for tuning in and for being part of these vital discussions on the future of healthcare. Remember, progress starts with understanding the challenges, working together, and never losing sight of what truly matters: delivering compassionate, efficient, and innovative care for all. Until next time, stay curious, stay inspired, and keep making a difference.